Otoplasty is the plastic surgery term given to the operation to set back prominent ears. And prominent ears develop usually because of the way the cartilages have developed in an individual person. For example, it may be that the antihelix, the curve I'm pointing to here, hasn't developed so well. If it's developed in a flattened way, as you can see as I flatten my ear cartilage, it causes my ear to be more prominent. And therefore, otoplasty surgery is about reshaping cartilage to give it back the natural fold in order to set back the ear, which might also involve setting back the whole ear as well as recreating curves. An otoplasty operation can be performed either under local or general anaesthetic, and it is performed through a scar that's at the back of the ear hidden towards the ear crease. Once the skin has been elevated off the cartilage, internal stitches can be put in a configuration to suit you as an individual to reshape your ear. We try and balance ears to make them as symmetrical as possible, of course, but there will always be slight differences between your ears, as there are in everyone in any case. The scars for an otoplasty sit at the back of the ear, so they're usually only visible when someone looks for them, pulling the ear back to see them. Occasionally, however, some people are bad scar formers or even form abnormal scars, known as keloid scars. These can be very thick and very prominent, and in the worst possible cases can even push the ear back out to make it more prominent, and they themselves can be very difficult to treat. So it's important to be aware if you have a history of bad scar formation or anyone in your family has a history of keloid scar formation, as this could be a risk factor that's very pertinent to you. Otoplasty surgery has a fairly quick recovery, but the key is to look after your ears because it will take a good 6 weeks for your body to regain the strength of normal ears, and until that time the fine stitches that have been placed in to reshape the ear are really keeping the ear in its new shape. So I recommend for the first week wearing a light headband, not to push the ears back but just to stop them from being pulled forward, particularly in bed. I would wear that every day and night for the first week, and then in bed at night for the further 4 to 6 weeks. And that, as I said, is not to try and push the ear back. In fact, a headband that's too tight can create its own problems. It's simply there to stop the ear being knocked and stop the ear being pulled back in the wrong way. The risks around otoplasty surgery, including those for other operations such as bleeding and infection. And specifically, if there was a problem with bleeding or infection, that can disrupt some of the internal stitches, which can make the ear recur. And in the same way, if in that early post-operative period you had an accident or the ear was knocked for some reason to an extent that the internal stitches were snapped, then the ear can come back out again. Now that means you could have revision surgery to set back the ear a second time, but normally would wait over 6 months, sometimes up to a year after your first surgery to do this, to allow the scar tissue that will have been laid down to soften as much as possible, which would allow the second operation to be more predictable and easier to do.